My client is a 51-year-old male. He is a full code and he was admitted on March 11th. He brought himself into the ER with complaints of leg pain to the right posterior thigh for 12 days. He denies any trauma or injury to the area, and he also denies any redness or swelling when he brought himself to the ER. His diagnosis is cellulitis and sepsis. On March 12th, he had an IND to the right posterior thigh, and as of right now, we're just waiting for the wound to close up. So during this procedure, he did test positive for MRSA in the wound as well. For discharge, as I mentioned, we're just waiting for the wound to close up right now. So as of right now, we don't have any discharge plans. It's currently pending wound improvement. He is awake and alert, ANO ×3. He's also walkie-talkie, moves all of his extremities, walks without assistance, showers on his own, has bathroom privileges. He's very independent. His blood pressure is systolic in the low 100s and diastolic in the 70s or 80s. Heart rate 85 to 100. Skin color is appropriate for his ethnicity. Pulses were 2+ bilaterally, and the pulses that I checked were the pedal pulse, the posterior tibialis, and the radial. No edema was noted in any of his extremities, and his capillary refill was less than 2 seconds in both his fingers and his toes. His O2 sats were 95 to 100 on room air, and his lungs were clear to auscultation. For GI, he can eat on his own. He ate all of his breakfast. He can swallow safely. His bowel sounds were normal active. His last bowel movement was this morning, and he said it was normal and formed as it usually is. Before breakfast, he gave himself 30 units of insulin. We're trying to reinforce his self-administration of insulin because he has a history of uncontrolled type 2 diabetes. He voids on his own, as I mentioned, can walk himself to the bathroom. His urine has been yellow and normal. His BUN was 16 and creatinine was 0.7 in his last labs. His skin, as I mentioned, he has that wound on his right posterior thigh, and then he also has an abscess at the back of his neck, and he refused IND for that one. It is closed, it's not open, and it looks fine. He said it's not causing him any pain. His dressing was changed this morning. I changed his dressing. The packing in the dressing was completely saturated with serosanguinous fluid. I administered fentanyl prior to the dressing change, and he tolerated it really well. He denied any pain or discomfort before or after the procedure. And then lastly, for skin, he does have a rash on his abdomen and his back. He was originally given Vanco for treatment of sepsis, and he developed this rash, so the doctor discontinued it. Initially, the rash was itching and it was bothering him, but for my entire shift, he denied any itching, so it seems to be getting better. He has a peripheral IV to the right wrist, and no solution is going through as of right now. We're just using it for fentanyl as needed for dressing changes. His labs look good. On admission, his white blood cells were increased due to the sepsis, but they have decreased and they're now within normal limits, so everything looks good with his labs so far. For his support system, he has his mother. She has not come to visit. He actually lives on Hilo, and he was here visiting his mom, and on his first day here is when he checked himself into the ER. And as I mentioned, his discharge is to be determined, where it's pending wound improvement. And then he is also working with a social worker because he lost his job last year and he hasn't been able to afford his insulin because he lost his insurance as well. So that is why his type 2 diabetes has been poorly managed. So we're working on reinforcing his insulin administration, working with a social worker to get his insurance figured out. And then we also want to make sure that when he does get discharged home, he has someone at home that can help him with his wound care and dressing changes. So that's also important.